here we will actually go in and talk a little bit about the Elos hybrid bases. So this is the current lineup. We already talked a little bit about the sneak peek. We will show later, but this is the current lineup of the Elos hybrid bases. So we're going to just talk a little bit about the engaging version of the hybrid base, where we have from the previous version we have a higher chimney, but we also have another and larger locking area. And the locking area here actually it actually again kind of adds up to a tripod feature where we have a locking area from the U shape together with the locking area on top. That again creates a stable and really nice indication when you insert the hybrid base into your restoration. So of course it's a one-way insertion, but it's easy to find and it's also quite stable and easy to mill, as we just discussed.
Yes, and I always have this user perspective a little bit as a dental technician, and I want also to highlight that we have the locking area at the top of the chimney, because usually and often some competitors, they have the locking geometry at the bottom. And especially if you have very small diameters, you have at the end you have a cam or something at the bottom, and you have a very small edge of your zirconia abutment to be milled. That means you have a risk of chipping, and from my experience, if the edge thickness falls down under 0.2 millimeter, you have a higher risk of chipping. And also, if you have very small gaps in this area, if the locking geometry is at the bottom, you are falling below your minimum wall thickness of the recommended material, like zirconia. It's probably 0.6, 0.8. You fall down on it because you have this bulb in the zirconia construction.
Yeah, so that is it's a really good point, Ralph. And here I just wanted to just give a quick highlight or benchmark up against the different versions that we have. We have a shorter chimney and we have a taller chimney. And what's important for all our hybrid bases, and we will discuss that later when we talk about the bonding, is basically the retention helixes. That we have this built-in mechanical retention on the chimney. Of course, we have our angulation, the U shape that allows for the angulation up to 28 degrees for the hexalobular. We'll also come into that. And then we have our cement space, as we talked about with the mating surface, that kind of fades out to zero. So meaning that we have the cement space around the chimney, but not at where it kind of merges with the hybrid.
So we keep the cement gap as small as possible.
Exactly.
So to speak.
Yeah.
Okay.
And if we take a quick glance at the non-engaging version, this is where we have the small antennas on top. In what we call the H-line, we have our guide grip, as we call them, embedded into the chimney. So it actually also increases our cementation surface area. And adds to the mechanical retention as well. But the guide grip features is a really nice feature that I really like, the fact that it can actually be held into the restoration.
Yeah, I'm a really fan of that. Also, as a dental technician, again, it's usually it's pretty annoying when you are doing a bridge construction of 2 or more implants, especially in the upper jaw. It always falls down in the articulator if you check the bite, the occlusion, the aesthetics. It always falls down because it's not bonded. Yeah. So what are you doing? You are putting Vaseline in it or whatever paste, putting in it to stick it on your model that it doesn't fall down. You can imagine if you're veneering it or stain it and it falls down, everything is gone. So I'm a really fan of that, and it's also not good if you go with the Vaseline in your ceramic oven for your heating elements and all that. So that's pretty nice. So you have this spring feature somewhere.
It's kind of like a preloaded spring that just fits into the mating surface.
Yes, and the same in the dental office. When you have a bigger reconstruction on implants, you want to make try-ins before you finalize it, to check the aesthetics, to check the functional aspects and all that. And this also allows you to make easy try-ins in the patient. Usually you have these try-in pastes, or also using Vaseline for that to make it sticky. But on the other side, Now you just put it on the hybrid base and it clamps.
Yeah.
So it's fixed also in the patient's mouth without gluing. That's a pretty nice feature.
It is. And if you look at again, the non-engaging, like a little benchmark, again, the retention helix is a really nice feature. It really adds to your surface area and it builds the mechanical retention. Again, the U-shaped triangulation that we already talked about. And when we talk about implant supported reservations, the regulatory aspects of it is, of course, extremely important. And this is something that we also take very, very serious. And of course, we have all the regulatory approval in all our main markets. But I think now we're going to talk a little bit about the screw.